would describe the PCICU as a really welcoming and warm place. From the nurses and the techs to the doctors and the surgeons, they're very kind, very welcoming. They know what they're doing. You can feel very safe there with your child.
If you were to walk into our unit, you would walk into a team of loving nurses. I understand this is a very overwhelming situation because some parents have never been in an ICU ever. So anything that I can do to put a smile on someone's face, I do it.
We have an exceptional group of people who provide fantastic care of children in the ICU. I've never seen a better team of people with a common cause, and that's to heal the children that are in the unit.
PCICU stands for Pediatric Cardiac Intensive Care Unit, and its focus is taking care of critically ill children with typically congenital heart disease, but something wrong with their heart.
So when you walk into the PCICU, you're going to go down this great hallway and you'll be greeted by the HUC, who handles the administrative things on the unit. And there'll be a waiting room off to your right, and if you head on down to your left, once the HUC buzzes you in, you'll go into the secure part of the unit.
Pediatric Cardiac Intensive Care Unit is comprised of all single bed rooms. The unit has 16 beds, so we can have up to 16 patients in the unit. Each child and family member has their room where they stay. We have glass doors across the front, but parents have curtains that they can pull closed when they need additional privacy. Families are in the unit 24 hours a day, 7 days a week. A family member can sleep at the bedside with their child. We encourage families to participate in care, things that they can do such as change diapers or read books or brush hair, whatever they can do to help us care for their child, we encourage them to do.
So there's a lot of beeping that happens. There are a lot of monitors that go off. There are a lot of alarms that parents are just like, oh my God, I don't even know what this is. And so what I do is I take the time to explain to them what each monitor alarm means, and I'll go through step by step.
You can see all these frightening tubes. You can see all these numbers up there. I don't want you to get focused on any number, but are we doing okay? Are we getting better? Or are we not? That's really the focus.
The nursing staff in the unit is comprised of staff nurses who will take care of the children in the unit, and those are the bedside nurses, so the direct caregivers. We also have a charge nurse every shift who's monitoring all the operations in the unit during that shift. We have a nurse manager who oversees the entire unit. Nurse-patient ratios in the cardiac ICU are typically 1-to-1 or 2-to-1. So a nurse who has one patient is in that room nearly his or her entire shift. The cardiac ICU actually has an extraordinary multidisciplinary team of people who are always in the unit. So we have our cardiac intensivist, who is the physician who is in charge of the unit. We have nurse practitioners, we have cardiologists, we have our bedside nurses, respiratory therapists, our social workers, and then of course our child life staff, who are fabulous at providing developmentally appropriate activities for kids.
On the bus go round and round, all through the town.
When we come to discuss their baby or their child on a daily basis, it's called rounding. And what rounds are is in the morning we get together as a group. We go over everything that has occurred the previous night. We identify all the goals of the previous day and have we achieved those goals, and we identify the new goals for the next day.
And it's an opportunity for everyone to be on the same page at the same time, crucially including the parents. So the importance for the parents is that they get to hear what we, the care team, think about the patient, but they also get to tell us what they think. And we have to always remember that nobody knows this patient better than his or her parent.
The most important thing you can do as a parent, as an advocate for your child, is to be as knowledgeable as possible. So ask questions.
You're a parent, and your job is to protect your child. All of a sudden, now you're giving that protection of your child to me and my team. We know that that is the most scary, thing you'll ever go through in your life. Every decision we make must be a joint decision that we all agree with. This is your most important asset, and you need to protect that, and we need to protect that too.
We hope that when a child is transferred out of the unit, that the parents have felt that they were an active part of their child's care and that they were an intricate part in helping their child heal and get to the point where they can now transfer out.
When we left the ICU, our son was doing amazingly well. We miss the staff. We appreciate all of their hard work. They remain interested in Jack's well-being and really invested in the time and the care that they spent giving him.